Hello everyone, welcome to Inconvenient Truths. I'm your host, Jennifer Zeng. As the current outbreak continues to heat up in China, other countries in Europe and Asia are also seeing a rise in cases of undiagnosed pneumonia. Meanwhile, China's foreign minister claims that at the United Nations that China's flu has been effectively controlled and invites people from all countries to visit China. In today's program, I'll briefly update you on China's epidemic situation. First of all, children's hospitals in Beijing and other places, as well as the pediatric departments of major hospitals, continue to be crowded day and night with patients seeking medical attention. Fever clinics and emergency departments have been registering thousands of cases daily far exceeding the usual number of consultations. The long wait times are causing distress among parents of sick children. There have been reports of parents surrounding Peking University Maternal and Child Hospital and Peking University Third Hospital to protest, urging the hospital management to assign more doctors for consultation or to divert older children to adult fever clinics for treatment. A teacher from a school in Beijing revealed that currently taking a child for medical treatment in Beijing means ordinary people have to queue for more than 10 hours. Those with connections can use backdoor channels to avoid queuing or to reduce waiting times. Beijing Evening News reported today, that's December 1st, that several hospitals, including Beijing Traditional Chinese Medicine Hospital and Tongren Hospital, have recently opened new pediatric clinics specializing in respiratory diseases in traditional Chinese medicine. Additionally, Haidian Hospital, Peking University Third Hospital, and the Yanqing Hospital have also recently opened new pediatric clinics for traditional Chinese medicine. On November 30th, the Beijing Municipal Center for Disease Control and Prevention released a weekly epidemic report on its website, stating that from November 20th to 26th, a total of 72,455 cases of 16 types of legally reportable infectious diseases were recorded in the city. The top two in terms of reported cases were influenza and novel coronavirus infections. On November 26, China's National Health Commission reported that the outbreak involved 7 pathogens, including influenza, mycoplasma pneumonia, adenovirus, rhinovirus, COVID-19, human metapneumovirus, and common coronavirus, with mycoplasma pneumonia being particularly severe. But contrary to the CCP authorities' claim to the WHO that the outbreak originated from multiple known pathogens, a Beijing resident named Zhao Lin told the official media China Newsweek on November 25th that her daughter had a fever and a cough, but the hospital could not identify the cause and only confirmed that it was not caused by mycoplasma pneumonia. In the absence of a clear cause of this wave of the epidemic, the CCP's mayor is to encourage everyone to get vaccinated in a timely manner. On November 29th, China's Center for Disease Control and Prevention posted on its official website that for respiratory diseases targeted by vaccines, such as influenza and COVID-19, it is recommended that key and high-risk groups get vaccinated promptly to reduce the risk of infection or the severity of the disease if infected. People over 65 and those who have not been vaccinated against pneumococcal pneumonia should also get vaccinated as soon as possible. If previously vaccinated, a booster can be considered after an interval of 5 years. Commentators have said that to vaccinate, one first needs to know the virus in question to target it effectively, making the CDC's suggestion seem absurd. Dr. Xin, a U.S. virologist, said in an interview with the Epoch Times that the current vaccines for respiratory diseases are mainly against the influenza virus and pneumococcal bacteria. There are vaccines for respiratory syncytial virus internationally, but they are mainly for people over 65 and are not yet sold in China. Therefore, the CCP's current call for vaccination is unlikely to stem this wave of pandemic. Another worrying news is that an 8-year-old boy from Nantong City, Jiangsu province, who was admitted to the hospital with pneumonia. 3 days later, he suddenly developed symptoms of right-sided hemiplegia and speechlessness. After a brain MRI, he was diagnosed with brainstem infarction. He was saved through surgery, but the incident of an 8-year-old child suffering from a stroke has sparked a lot of discussion and concern among Chinese netizens. People are asking, is this really Mycoplasma pneumonia? Why didn't the officials specify the cause? On November 30th, a teacher from a school in Hunan province disclosed that he or she had been feverish all night, and all the students in his or her class suddenly developed fevers en masse. Virtually everybody was sick. As a matter of fact, only one student in the entire class did not have a fever. But after learning that he was the only student left in the whole class, his mother became very concerned and took him home. Another pregnant teacher also fell ill. When she went to the hospital, the doctors did not test her for mycoplasma and were hesitant to prescribe her any medication. They only administered nebulizer treatment to her. Therefore, overall, the epidemic in China remains very serious with no signs of abating. In the meantime, there has been a recent surge in cases of undiagnosed pneumonia among children in some parts of Europe. Not only have pneumonia cases been reported in Asian countries like South Korea, Taiwan, and Vietnam, but an unusual increase in respiratory disease patients has also been noted in France and the Netherlands in Europe. In the Netherlands, there has been a rapid rise in pneumonia cases among children aged 5 to 15, but the cause remains unclear. Is this the onset of a new pandemic? I think we still need to closely monitor the situation. Meanwhile, the CCP's Foreign Minister Wang stated at the United Nations headquarters in New York on November 29th that China's influenza has been effectively controlled and said that influenza occurs in any country. He also welcomed more people from various countries to visit China. I think by now everybody knows that many times the words of CCP officials must be taken with a grain of salt. Covering up the epidemic and the negative news has almost become an instinct and a standard operation for the CCP. Therefore, when the CCP says the situation is under control, we need to interpret their words cautiously. I know that after experiencing the torment of the pandemic over the past 3 years, no one wants to go through the same thing again. We can only hope that history does not repeat itself, while also closely monitoring the development of events. Well, that concludes today's brief update. Please remember to subscribe to my channel and verify if you are still subscribed, as YouTube has been significantly suppressing my content. Also, I encourage you to visit my website at jenniferzengblog.com, jenniferzengblog.com. There you can sign up for a membership or make a donation to support my work. In a time when the CCP's official media and the so-called mainstream Western media either spread lies or fail to report the true situation in China, the existence of independent channels like mine is crucial for global awareness. Thank you. Have a nice weekend, and see you soon.